This is a very important lecture. It's about hip arthritis or spine conditions. Which one is causing the pain? Can it be something else? It's extremely confusing conditions. Doctor, is it my hip or my spine that's causing me the pain? So you examine the patient, you try to find out, and everything hurts. But you want to make sure that you know the primary source of the pain. Is it the hip or is it the spine? It may be difficult for us to determine if the symptoms of the patient comes from the hip or comes from the spine, or is it coming from both or is coming from another source. A patient with a hip problem or a lumbar spine problem can have low back pain. So if you have a patient with a hip problem, ask the patient if they have a spine condition. Hip arthritis have a classic presentation, so as the spine patient, but they overlap over each other. The patient with hip and groin pain that's limping with intelligent gait is probably a patient with a hip condition. So the hip pain will be anterior and will be deep groin, and a patient with groin pain is 7 times more likely to have hip disorder than a combined lesion with the spine, or maybe very rare to have a spine condition that's going to the hip joint. But the buttock is the most common region of referred pain in an isolated hip condition like arthritis, followed by combined thigh and groin pain, and never to the lumbar spine. The pain radiating below the knee can occur from a spine or a hip in about 47% of the time. In general, patients with hip arthritis will have pain in weight bearing with decreased range of motion, especially internal rotation if we detect the arthritis early. So if you have a patient with a limp, groin pain, decreased range of motion, that probably arthritis. In patients above the age of 45, you'll find hip arthritis in about 27% of the population, but it is symptomatic about 10%. So if you get an x-ray and you see arthritis in the x-ray, it doesn't mean this is the source of pain to the patient. It doesn't mean that the patient have arthritis and needs total help. You got to correlate the clinical exam with the x-ray, with the MRI. Just because you see arthritis in the x-ray, it doesn't mean it's causing the problem. Another problem you have is the patient may tell you, I have hip pain. The patient may be pointing at the buttock and saying it is hip pain. The hip itself may be normal. So when the patient states that I have hip problem or my hip hurts, it doesn't mean the pain is coming from the hip joint itself. So ask the patient to point to the site of the pain. This is the model. You can see that the hip joint is right here. I'm going to point out with the pointer. It's right here. And look at the areas that's close to the hip joint. This is the trochanteric bursitis, which is common. This is the SI joint, which can occur. And this is the spine condition, which can happen. In addition to the piriformis syndrome. So they are all connected within few centimeters from each other. The pain can be a little bit posterior, like coming from the piriformis syndrome, or it can be far posterior, coming from the SI joint. Now you don't know it's a buttock pain, hip pain, or SI joint pain, or spine pain. They're all overlap. So if you suspect the sacroiliac joint, which is really difficult to diagnose, then maybe injection will help. And if it does help and the patient is better, even with lidocaine injection itself, that means it is the SI joint problem. And then you move on, you know, to for the treatment and the plan. Because arthritis of the hip, arthritis of the spine can present in the same patient. Sometimes you don't know which one is more important. You got to have the careful history and the exam. You got sometimes to inject the hip and see if you get 50% improvement in the hip joint, then you probably be dealing with hip problem, but you need to delay the surgery for at least 3 months on the hip because injection increase the incidence of infection. The patient with lumbar stenosis have similar walking difficulty like the hip, but they are not identical, but they have walking difficulties. So they will be arched, their back flexing it. They have neurogenic claudication. They have the shopping cart sign. You get an MRI, you find a lot of discs in the MRI. Let's say a hip doctor will do that and say, oh, it is the spine. No, just because he's seen a lot of changes in the MRI or positive findings, it doesn't mean it is the cause of the pain for the patient. This may be asymptomatic, and the incidence increases more with age. So you need to correlate. You need to correlate the findings with the MRI, the clinical findings with the X-rays. You need to have a bigger visual clinical picture. The problem, the hip doctor treat only the hips. The spine doctor treat only the spine. So there is confusion about who does what. But the patient may have both conditions, and the doctors struggle and they have delay in the diagnosis and treating that patient. In spinal stenosis, the exam is probably normal, and the patient rarely have neurological deficits. But if you have an anterior hip pain deep in the groin, it's probably arthritis. If you give the patient injection in the SI joint and the SI joint is better, then it's probably SI joint problem. The symptoms overlap in all of them. And you can see here you start with physiotherapy, anti-inflammatory condition, and everything else. And at the end, you give them an injection. But really, how do you differentiate between the two conditions? In lumbar stenosis, standing increases the symptoms. For the hip, tying the shoes increases the symptoms for hip arthritis. Just bending over to tie the shoes, it's hip arthritis. Standing increases the symptoms for spinal stenosis. In spinal stenosis, the neurogenic claudication with back and lower extremity pain is very obvious and it is marked. This is the main symptoms that the patient will complain. And it is worse by walking and is relieved by sitting and bending forward. And you can see here the leaning over the shopping cart will relieve the patient's symptoms. When you see a patient and the patient is leaning forward, then this is the spine stenosis. If you see a patient and the patient is limping, it's probably hip arthritis.